there are some things that we can vaccinate against. Antibiotics don't work against viruses. Same way in humans, same way in companion animals, same way in chickens. So we use a lot of our vaccines against viral components, and antibiotics have no effect against, right? And that's a situation where really vaccination only is the only way to get protection. There are a lot of bacterial components that we can vaccinate against. We do have a good toolbox of vaccines against some of our bacterial pathogens, but there are a lot of different bacteria that can cause disease in any setup: humans, companion animals, chickens. And so there are times when the use of antibiotics is necessary to treat flocks. The issue in the poultry industry, or what has become an issue with consumers and advocates, is the judicial use of antibiotics, or the use of antibiotics as what's been termed as growth promoters. And that's really a misnomer. That was the language that was used. It was probably mislabeled in the beginning. That wasn't a very good label to place on it, because we're not using antibiotics to promote growth. What we are actually doing is stabilizing the bacterial content within the bird. And so they are still serving the same purpose that they would serve if you got an infection and had to go to the doctor yourself. You get an antibiotic to stabilize that bacterial population to prevent disease. The question of contaminants in poultry meat, whether it be antibiotics or even back to the hormones question, is one that's common in the general community. But it's really, I would say, not a valid concern, because we do have withdrawal times for all of our antibiotics. If we use an antibiotic in poultry, whether it be as a growth promoter or as a therapeutic treatment, there is a specifically defined withdrawal time that's governed by the FDA and the USDA. And all poultry meat is tested as it comes through the processing plant to ensure that there are no residues of any of these antibiotics or even chemical compounds present in the meat as it goes through slaughter, to ensure that there is no induction of, or there's no transference of some of these compounds to a consumer. The larger concern was not because these programs were originally implemented not because of transference of an antibiotic to a consumer and then that person developing an antibiotic resistant bacteria within themselves. The original concern was allergies. Somebody may have a penicillin allergy, or maybe they're allergic to tetracycline. And if there was a contaminant on a product, and it could be beef cattle, it could be in dairy, it could be in poultry, but if there was a contaminant in that product, they may have an allergic reaction to it. And that was the reason that all this testing has been put in place, to ensure that you're not going to have any residues that may induce a reaction in a person like that, not for antibiotic resistance.